Hello friends, my name is Dr. Puru Dhawan, and in this video we will talk about brain stroke, type of brain stroke, and why brain stroke affects the mobility of your arm and legs, and how we can recover from this brain stroke. Brain stroke is a condition in which the part of the brain gets damaged. This damage can be caused by any kind of blood clot, which causes the deficiency of oxygen in the brain part of the brain, which causes death of brain cells, or it can be caused by any kind of brain hemorrhage in which the artery or the capillary in the brain bursts. Because of this burst, the blood leaks in the tissue of the brain, and this blood causes the damage of the brain tissue. Because of the damage of the brain cells, what happens, functions of that part of brain gets affected, and when the function gets affected, the functions to control your arm, the function to control your leg also gets affected. That results in immobility of your arm and leg. So if a patient suffering from brain stroke wants to recover from immobility of his arm and leg, we have to start from the brain itself. We have to look what kind of damage is happened because of this brain stroke. When a person suffers from brain stroke, what we usually see is that patient is advised with some kind of physiotherapy, exercise, some kind of medicine for their blood pressure, some medicine for their blood thinning, but no such medicine is advised for their brain cells recovery. So at Sai Sanjivani, we advise all patients of brain stroke to understand their condition first. Once you understand your condition, you can easily control, you can easily recover. So in a brain stroke, when your cells is affected, your brain cells is affected, we have to start the treatment from the brain itself. What we do, we at Sai Sanjivani advise patient to do those exercises which helps the patient to recover faster, and we advise them to those medicines which works on the brain only. Because what we see is that when a person suffers from brain stroke, what happens, in initial 6 months patient shows tremendous amount of recovery, but after 6 months this recovery disappears. Even after vigorous exercise, vigorous physiotherapy, the condition of the patient doesn't improve. So we have to rethink how we can restart our brain cells, how we can increase the functioning of the brain cells. So what we do is that we provide those medicines which increases the interdentrite connection between the neurons of the brain. And when the neurons interconnection increases, brain make additional pathway to send information to your muscles of arm and leg. Because now new part of the brain is working, we have to train that part of the brain to control the muscles of your arm and leg properly. So we have to advise all patients of brain stroke to go those exercises which helps the brain to make adjustment so that that new part of the brain can control your muscles of arm and leg easily. For that purpose, we advise occupational therapy, not physiotherapy, occupational therapy, because occupational therapy is specified for your brain. If a patient wants to walk, if a patient wants to learn how to walk again, one has to walk. Because what happens when we do occupational therapy, our body sends signals, send feedback to the brain that you are not walking properly, your leg is moving outside and taking a outward movement. This feedback helps the brain to make further adjustment so that that walk, that gait can be improved. Similarly happens with the arm. So if you are suffering from brain stroke and you want to recover your mobility again, you have to understand your condition first. You have to understand your brain first, then only you can recover from that point. You have to understand the limitation of your brain, your limitation of your medicine, limitation of physiotherapy. Then only you can understand why you are not recovering even after vigorous exercise, vigorous physiotherapy, because you are not working on your brain tissue. After brain stroke, what happens, brain starts to recover itself, brain starts making further internet connections. So if you are a patient of brain stroke and your golden period of initial 6 months has been passed, now it's time to rethink what you are doing, because after 6 months your brain stops to make further neural pathways. We have to start that neuroplasticity, we have to increase the interdendrite connection. For that purpose, we have to give you those medicines that will help your brain cells to make further interdendrite connection. We have to start the healing process. We have to make further neural pathways to control your arm and leg, and this process is known as neuroplasticity. Neuroplasticity is a natural healing process of the brain cells, and in a brain stroke patient, neuroplasticity is very important, because only with the help of neuroplasticity we can make a patient recover from its immobility to move its arm and leg. So if you are suffering from brain stroke, your arm and leg is paralyzed, it's time to rethink your treatment. It's time to go for neuroplasticity. You have to increase your interdentrite connections, you have to work on your brain, you have to work on your occupational therapy, you have to work on your exercise. Then only a patient suffering from brain stroke can recover. If you have any question regarding brain stroke, paralysis and neuroplasticity, you can simply call on the number given below. You can also book an appointment with me on the same number. You can also visit our website saisanjivani.com for further information. With this, allow me to say goodbye. See you in the next video.